an inflamed one. You find some patients having swelling, which is associated with arthritis too. You find some patients having pains, especially in that particular joint. If you look at the picture before you, we have a pictorial view just before you for you to really have an understanding of what we are talking about. We have stiffness around the joints. You can have stiffness around the joints. The place can be reddish because it is inflamed. Some patients complain of pains and warmth. Then in some patients, we see the patient having difficulty in walking. I find the patient having difficulty in walking. So please, I want us to look at the different types of arthritis. Arthritis has different types. One, we refer to it as osteoarthritis. The second one, we refer to it as rheumatoid arthritis. We have another type of arthritis called gout. We have juvenile arthritis. We have psoriatic arthritis. And if time will permit us today, we'll be looking at the ankylosing spondylitis, which is another form again that we see in patients with arthritis. So if time permits us, we'll be looking at that last one. So please, let's take note of the different types. We have osteoarthritis, rheumatoid arthritis, gout, juvenile arthritis, psoriatic arthritis, and ankylosing spondylitis. Now, we will be discussing this in details as we move on. So, but before we go into the detailed explanation of these different types of arthritis, let us quickly look at the global and Nigerian incidence of arthritis. As a matter of fact, arthritis is a condition that we all must be worried about because research that was done by WHO clearly states an increase. There's an upsurge of people globally having different types of arthritis. You know, I've just mentioned the different types to you. We'll be looking at all of them holistically as we move on. Now, if you look at the statistics that WHO is giving to us, just between 1990 to 2020, within 30 years, we've had 132.2% increase in arthritis, especially osteoarthritis. So you can see that it is not something we should be joking about, which is something we should be worried about. Now, the second type of arthritis tends to follow that same upsurge. The same period of 30 years between 1990 to 2020, the WHO equally report is 121% increase in rheumatoid arthritis. And if we continue, you'll find out that almost the other types too, there's an upsurge. If you come down to Nigeria, it is the same problem we are having. Osteoarthritis, rheumatoid arthritis, juvenile arthritis, as well as the other psoriatic arthritis, gout, they are increasing on a monthly basis. I don't even want to use daily so that we can see the enormity of the problem. On a monthly basis, if you look at the statistics, it's so painful and alarming. So today's lecture that is coming to us, Courtesy Super Life, is really going to educate us. It's truly going to educate us, and that's really we will do justice to it with a three-man medical team that we have and other paramedical personnel that are with us. So let's look at osteoarthritis. What is osteoarthritis? If you look at the diagram before you, you are looking at, we've just taken the kneecap, the joint that's just by the knee. And osteoarthritis is a very, very common type of arthritis. And it Hello, can you hear me now? I was muted. Hello?
Yes, sir.
Yes, somebody muted me. Please, I'm back. I'm back on again. Now, I was talking about osteoarthritis. I said it's a very, very common form of arthritis and it's affecting a lot of people globally, including Nigerians. Now, how does this particular one happen? This one is the one that we say is associated with age, especially if you're from 50 and above. A lot of Nigerians, a lot of people globally that have gotten to 50 years and above, they begin to experience this type of inflammation around their joints. And what is really occurring is that the cartilage, if you look at the diagram to your left, the cartilage there, the articular cartilage is supposed to provide, with the meniscus, is supposed to provide proper lubrication as the person walks so that the person does not feel any corrosion leading to pain. But as the person age, as the person grows with age, this is just one condition that can lead to it. There are so many other conditions that can lead to osteoarthritis. But as the person begins to age, we find in some patients where there's a cartilage loss. Then you now find bone spurs appearing within this joint. I've already given you a definition for joints. Then as soon as this begins to happen, that particular section of the joint becomes inflamed. So it can be in the knee, it can be in your hips, it can be in your spine. So it is not just the knees alone. It can occur in any part of the joint of the body. So osteoarthritis is one. Let's move on. Let's look at the different types of osteoarthritis. We have primary osteoarthritis, is the secondary osteoarthritis. Primary osteoarthritis is a very, very common, or is the most common form of osteoarthritis that we see, especially in the reported cases that converge our hospitals. Dr. Chooks is around. You can even maybe briefly throw more light on that. It has to do with exactly what I had explained earlier. As one ages, there's this wear and tear around the joints. But in the case of secondary osteoarthritis, this could be attributed to either accidents or direct injuries to your joints, especially depending on maybe you were involved in any external or environmental injury. So this particular type can lead to damage of the cartilage and can now lead to what the medical personnel refer to as a secondary osteoarthritis. How common is osteoarthritis? I've explained it earlier that a lot of adults, especially those from 50 and above, we look at 55 in some statistics. For me, from 50 and above, 55 and above of adults tend to come down with osteoarthritis. We're looking at an average of 80% of adults that are from 50, 55 and above. So what can cause osteoarthritis? I've already explained it. Once the cartilage begins to degenerate and it begins to wear, and the tear now begins to allow the joint to inflame. So what are the signs? The patient will see stiffness around the joints, pains around the joints, swelling around the joints, and difficulty in walking. So now we know that osteoarthritis is very common. We have the two types, primary and secondary. We now know what it is. Let's move on to what can cause this osteoarthritis. I've told you earlier that one has to do with age, the other one has to do with injuries, accidents. So then another condition the medical personnel have equally observed that can be responsible for osteoarthritis is a syndrome that is referred to as the Ehlers-Danlos syndrome. It's a genetic disorder. And because of time, we will not be going into details. Then there's another syndrome called the joint hypermobility syndrome. This one you find in patients where their bones, their joints are so flexible than normal. So yet again, patients like this come to the hospitals and doctors, in order to differentiate the different types, tend to look at the condition these patients are coming with. So now we have looked at osteoarthritis. Let's look at rheumatoid arthritis. I'm sure by now all of us now know what osteoarthritis is. In case you are listening to me and you feel you have arthritis, you should, at the end of this lecture, be able to determine which particular one you are going through. The second one is rheumatoid arthritis. This particular one is very common with women. The incidence, the prevalence of this condition is more with women than with the men. It is equally a chronic autoimmune disease. Each time in this lecture we use the word autoimmune, all we are trying to say is when cells of your body on their own begin to fight other cells. Cells that were once normal, healthy, all of a sudden begins to misbehave. So in this case, you now find that the joints becomes they say when two elephants fight, it is the grass that suffers. In this case, it is the joints that becomes attacked. If you look at, we've seen so many women who's with rheumatoid arthritis in their hands. I've seen cases where a woman will fold her fingers, and when she releases her fingers, not all the fingers become straight. She might need the other hand to help straighten the fingers that have refused to become straight. I've seen cases like that a lot, and it's really common with women. And we are going to see why that is so. A lot of people with rheumatoid arthritis, it affects the joint and can as well go as far as affecting the heart, lungs, eyes, and the skin, causing inflammation in those areas. If it is affecting the heart, it results in what the medical personnel refer to as pericarditis, which is inflammation of the sac around the heart. Then it can, once this happens, it makes the patient find it having pains in his or her chest. Another condition this particular rheumatoid arthritis can lead to is coronary artery diseases, as well as congestive heart failure, and so many others like that. When it attacks the lungs, it leads to what the medical personnel refer to as pulmonary fibrosis, which is carrying of the lung that can cause difficulty in breathing. We've seen cases like that. I have seen this case a lot. So that is rheumatoid arthritis. What are the stages of rheumatoid arthritis? Our women listening to me today, please, if you know you are experiencing this, please don't forget, after today's lecture, try and contact Dr. Chooks, our in-house medical doctor, as well as our SuperLife country director. We can all be of help. I will be there too to be of help. Now, there are 3 to 4 stages of rheumatoid arthritis. Stage 1. Rheumatoid arthritis stage 1 is inflammation has already started, but the patient is still not feeling joint pain or stiffness. The patient can still use the joints. But for stage 2, inflammation have started and pains have started coming in, and stiffness of the joint have started coming in. For stage 3, you now find out that there's severe pains. The patient is now beginning to complain of severe pains, not just the stiffness alone, not just the inflammation alone, not just the swelling alone. The patient is now in pains. At this stage, the patient needs to see or rush to the hospital because he or she will not be able to bear it at this stage. At stage 4, the pain may have gotten down, the swelling may have gotten low, but then the wear and tear in the bones would have started so badly. So please, if you know you are having any of this condition, please see our office. What are some of the symptoms those with rheumatoid arthritis see? Pain, swelling, stiffness, tenderness in the joints. I've mentioned this: fatigue, weakness. Sometimes they have fever. Some of them experience loss of appetite. There's pains in the eyes, inflammation of the eyes, and so many others. There's a lot attached to rheumatoid arthritis, just like I've said. So it is not an arthritis we should take for granted. I've already told you what can cause rheumatoid arthritis, but there are some other things that can lead to it. Like women, their hormones play a major role outside genetics. That's inheritance. Either the patient may have inherited it from forefathers or foremothers, uh, then their hormone secretions, environmental factors play a major role in rheumatoid arthritis. Then some people can even bring it upon themselves, especially those who are often prone to infections. Once you are prone to infections a lot, as a woman, as a man, you can develop this condition. Some people smoke, some women smoke, and the ladies are more emotionally stressed, and all these are triggers to rheumatoid arthritis. So please, if you are listening to me as a woman, please, I will want to plead with you to see how you monitor your emotions. Please, if you smoke, stop, and please stay off infections. And that's why this lecture is coming to you every week. This is another arthritis. This particular one, I've seen it with a friend. It's called gout. Each time a patient with this kind of condition begins to experience this type of arthritis, which often is seasonal, it's not all year round, patients with this kind of arthritis have pains. This particular type, from observation from cases that we have seen, is often seasonal. This is arthritis of the big toe. This particular one attacks the big toe. It attacks other joints, but with more emphasis on the big toe. That is why the diagram you're looking at is showing you your big toe. So if you have gout, there's every tendency that medical personnel will be looking at your big toe. That is where the joint gets inflamed. And what can make the joint there become inflamed? It occurs with patients with excess uric acid, which we refer to as hyperuricemia. So increased uric acid production in the body. There are so many things that can lead to that. We'll be looking at it. So that is one basic factor or reason where patients with gout have this type of arthritis. It can be very, very painful. I've seen a friend with it. Each time it starts, believe you me, he can't walk. It's the wife and the kids that helps him to walk. And it is always seasonal. It comes at a particular time of the year, especially when the weather is cold. Let's move further. What are gout symptoms? One, I told you they are very, very painful. Those with gout know what I mean. The pain is so intense. There's this discoloration around the big toe, redness, stiffness, swelling, and the person feels as if his feet is on fire. So just like I've said, it is when the acid of the body is so becomes increased. Please, I would like people who are speaking to mute their mics. So where we have levels of uric acid, you find the patients develop crystals. And once there's this crystal build up along the big toe, the joints of the big toe, you now find the person having an inflamed joint. So now we know what gout is. I still want to plead with those who are having this condition on their big toe to consult our office. I'm going to be fast because to allow our other. We equally have another type of arthritis known as juvenile arthritis or juvenile idiopathic arthritis. Please, somebody is muting me. Please, somebody is putting my mic on mute. We have another type of arthritis referred to as juvenile arthritis or juvenile idiopathic arthritis. I'm sure all of you listening to me will be wondering, so children too can have arthritis? Yes, children too can have arthritis. It's an autoimmune condition. And just like we keep on saying in this lecture, once there's an autoimmune disease, it can lead to anything depending on the age it is presenting itself, the age of the person it is presenting itself. So in this case, you now have inflammation of the joint in children. Now, what the medical personnel want to do is they want to determine something. Please, let's go there. There are several types. So they want to know which of the types of juvenile idiopathic arthritis is the child having. The first one, we refer to it as oligoarthritis. Now, in order to determine whether this particular child is having oligoarthritis, the number of joints that are affected will have to be calculated. So once the joints affected by juvenile arthritis are fewer than 5 or less than 5, then in this case, we are looking at a particular type of juvenile arthritis known as oligoarthritis. Please, I'm just trying to meet up with time. So I'll be fast. I will not want to go into too much details. In case your child is having anyone consult our office, we'll be able to be of help. The second one is polyarthritis. In this case, the number of joints that have been inflamed on this child is far above 5 or more than 5. So once we have far more joints above 5 that are inflamed in a child, then we know we are looking at polyarthritis. Then we equally have another type known as psoriatic arthritis. In this case, is this child having psoriasis? Psoriasis is more of a dermatological condition that can affect children and affect adults. We are going to see the adult type of arthritis that is associated with psoriasis. So in this case, if the child is having psoriasis, then we may be looking at psoriatic arthritis. Why? Because the skin of the child is having rashes, and there are patches, lesions on the child's skin, and at the same time, the child is having inflamed joints. We have another type of arthritis with children. I'm sure all of you are shocked to see that there are even more different types of arthritis with children than even with a single male or single female. There's another one known as the enthesitis-related arthritis. Enthesitis-related arthritis, also known as spondyloarthropathy. Spondyloarthropathy, please, let's get it right. This particular type affects the spine and the hips of the child. The spine and the hips of the child. The medical personnel refer to it as spondyloarthropathy. Then the last one there is systemic arthritis. This one is it's called Still's disease. It's not too common, but then it is still seen with children. So this particular type normally involves the lymph nodes swelling. So once the child's lymph nodes are swollen, and the doctors will want to do a check to find out which particular type. Are they looking at systemic arthritis here? So these are some of the arthritis that are associated with juvenile arthritis or juvenile idiopathic arthritis. For our non-medical personnel, please bear with us with the medical terms. You cannot be discussing health without using the medical terms for them. So I hope I'm not too fast. For those who are taking note, the office can equally send this lecture, or you go online via our YouTube channel and watch it at your comfort. What are the symptoms of juvenile idiopathic arthritis? I've mentioned the child will definitely be experiencing pain. There will be swelling because the place is already inflamed. The child will be having difficulty in walking. Some children will present with fever. If it is a psoriasis, you find rashes all over or on the elbows and joints of the child. The child experience weight loss. Look out for lymph node swelling and eye redness and so many other conditions. So these are some of the signs and symptoms the doctors look out for to determine what the child is going through. Earlier, I told you when we're looking at psoriasis, I told you that the adults took what is referred to as psoriatic arthritis, PSA, psoriatic arthritis. For some of you looking at the diagram before you, you'll find these are adults. Look at their skin. You can find there's a dermatological condition there. These are fungal-like skin conditions on the skin. And once this is seen, you find that these same patients equally have inflammations in their joints. So once you find a patient with psoriasis and the person is equally experiencing joint inflammation, so in this case, we are looking at psoriatic arthritis, because the first thing the medical personnel want to look at is to determine psoriatic arthritis is the presence of psoriasis. So the skin matters a lot to the doctor. So once they see all the visible signs and they now look at the patient's joints and the person is having all of these inflamed joints, then they equally look at the fingernails of the patient, the toenails of the patient. Why? Because there will be color changes to the nails. So once they see these color changes, look at the skin for some dermatological changes. At the end of the day, they look at the joints, it's inflamed. So what they have in their hands there is psoriatic arthritis. There are different forms of psoriatic arthritis. We have the distal interphalangeal predominant psoriatic arthritis. Please pardon our terms. We are not doing this intentionally to block your ear, but we just need to mention it. I'll take it again. Distal interphalangeal predominant psoriatic arthritis. This affects the joints near the end of your fingernails and toes. You remember I told you earlier that psoriatic arthritis brings about, in some patients, color changes to the fingers and the toes. Then we equally have another one, symmetric polyarthritis. So here we have 5 or more joints that are affected. Remember when we're talking about juvenile arthritis, we were counting the number of joints. So we do the same here to determine the type of psoriatic arthritis. So when there are 5, so we're looking at poly. Then we equally have asymmetric oligoarticular psoriatic arthritis. Here, you now have 2 or 4 joints on both sides of your body. While polyarthritis, that symmetric polyarthritis, could be, we're looking at 5 joints, 5 or more joints within a particular section. For asymmetric oligoarticular psoriatic arthritis, we are now looking at 2 to 4 joints on different sides of the body, so being affected. The next one is spondylitis. Here, the spine is now the one that is affected. Then we equally have arthritis mutilans. Here, it affects, the inflammation is usually severe. Are you getting it? Leading to bone loss. Once there's a bone loss, that means the inflammation has become so severe that the patient is. So in this case, we are looking at arthritis mutilans. So on your own, you will not be able to know until the medical personnel. But when we started earlier, the country's director was telling us that looking at the word arthritis at face value, you may just think it's one simple thing. But going into it, we are beginning to see a lot on arthritis alone. That is why this our evening Friday lectures is very helpful. It helps us. It educates us. The most common psoriatic arthritis symptoms include joint pain. I've mentioned them. Your nails will change, fatigue pains, and all of that. So let's not go back there. I've already explained them. Now, your psoriatic arthritis, how can you get it? Most times it is genetic, maybe transferred from parents to offspring, so it is hereditary. You find them in your genes and all of that. So, and some lifestyles too probably can bring it. Let's look at the last one. Let's look at the last one because of time. The ankylosing spondylitis. Yes, ankylosing spondylitis is a condition. It's an autoimmune disease as well, where your immune cells, rather than fight for you, are now attacking your own body cells. And in this case, your joints are now the ones suffering. Now, but in this particular condition, it is your spine. Your spine. If you look at the lady to your left, you find out that the normal standing erect position, you can see how the position of the spine curves. But once the person is having ankylosing spondylitis, you find the patient bending forward. Why? Because the joints are stiff. There's serious stiffness to the joints, as if the bones, the joints are fused together, leading to severe pains. So there's need for us to see. You find some people bent. You find them bent, and you begin to wonder, yes, it is a form of arthritis. But in this case, the doctors know what they are dealing with. So you have serious, it can affect the spine, it can affect so many other areas, but notably the spine. So please, I want us to take note of all of this. At this stage, I think I've done justice to the different types. I was a bit fast just to create time for the farm, and I want to plead with the farm to do justice to a bit fast so that we can give our doctor, Dr. Chooks, enough time to explain the new device that we will be for the first time in our Friday class, how it can be used to solve these different types of arthritis. So we want to give Dr. Chooks enough time. So at this point, I want to invite our farm Chilaka. Please, are you there? So that you take the diagnostics test and treatment, the orthodox. Let Dr. Chooks handle the Super Life product. So you can leave out the Super Life product for Dr. Chooks. Just help us use the orthodox diagnosis and treatment for arthritis. So farm, you have the floor. Thank you.
Okay, good evening, everybody.
Good evening, farm.
Yes, thank you, sir.
Yeah,
you have actually touched on virtually everything, though. So I don't even know where to even look at anymore.
No, just look
Thank
at
you very much,
the
sir.
diagnosis and test. Just look
You
at
have
that.
done
Yes, for the orthodox way, yes.
you have done justice to it already. Okay, let me quickly rush to what we have. Arthritis. How do you manage arthritis? Please, 1 minute. Trying to open up the slide. My screen is not very. Yeah. So, how do you diagnose arthritis? Diagnosis of arthritis. And well, if we have listened to what Prof has taught us this evening, I believe it's very clear that for proper diagnosis of arthritis, of course, it will be a physical examination. All right, because we are looking at damages on your joints. All right, the joint tissue. and it's right your account. So we are looking at damages in your joints and all. And so the first thing the doctor, most especially the orthopedic uh, doctor, is to do a physical examination by looking at the area where the complaints are coming from. All right. Um, to know if yes, if the complaints are anything suggesting arthritis. All right. You look at the affected area and then also get down the symptoms. All right. To be sure that because a lot of health conditions have a way of affecting your joint and not necessarily arthritis, right? So if you have kidney infections, sometimes even when you have certain infections like salmonella typhi, that's typhoid fever, or you even have malaria, sometimes it may manifest around your joint region where you have some form of inflammatory pain, inflammatory conditions and stuff like that. So it is important that proper diagnosis is done to streamline it. So based on what the complaints are, will be suggestive.
5 minutes, bring it.
Be suggestive for
You
arthritis.
bring it now. You bapping?
And so in that regard, how do you not test for it? All right. So basically, if I'm going to, it's not like an infection that you are going to do a microbiology test. All right, where you take the sample, the blood samples, or you take the semen and all that, as the case may be. All right, this is bone. You're looking at the joint and the bone. So basically, any test you're going to do to confirm the damage around the joint tissues, all right, must be viewed. You must look at the image. And so basically the test you do, you can do the MRI or the CT scan. All right. That would, and then the X-ray is still is not so sensitive. All right. So most of the time they want to do the CT or the MRI just to have a clear picture of what the image looks like. And so what that does is it projects the joint, the area of complaint, whatever part of the joint you are having that complaint. Is it around the hip, all right, or the waist, or the ankle, whatever place it is, the scan will project it, and so that the healthcare provider can actually see the level of damage or what kind of damage may have occurred vis-a-vis the symptoms or the symptomatic expressions of the patient. All right. Now, one of the things they want to see in the test, what the test will show, will determine the severity and the degree of damage, the degree of wearing out. All right, the wear and tear, because basically, especially when we are managing osteoarthritis, we are looking at the wear and the tear. Now, Prof mentioned, he mentioned things like cartilage. And the cartilages are tissues that make up the joint. They are around the bones of the joint. And so when we say, just to put us in the right perspective, when we say a joint is simply a place where two or more bones meet. It's as simple as that, like a junction. All right, two or more bones meet. So just imagine you now. All right, I hope you can hear me, please. I want to be sure you can hear me.
Yes, sir. Go ahead.
Fantastic. Just
We are with you.
imagine yourself. Thank you very much. Look at your legs between the femur and the other part where you have your ankle. All right. There is a knee there, right? Your knee. Now, your knee is a joint. The knee joint there connects the lower part of the leg and the upper part where you have the femur, right? Now, imagine a car. When you look at a vehicle, a car, there's what we call ball joints. Those of us who drive cars, or even not just cars, machines generally, you will always see wherever two or more metals come together, there's always a joint, something like a boris, all right, round like this. Now, that's also the same way God designed our body. So whenever two or more bones are going to connect, God also ensures that the two or the connecting bones are not touching each other or touching one another. Because whenever the bones collide, once there's a collision, the signal it sends to you. You feel it as pain. For God to ensure that the bones are not colliding, there's no collision, He now puts in what we call cartilages. So the cartilages are surrounding tissues. And now the system around it, you have the synovial fluid and all that. You have the synovial ligaments and tendons. And so what they will do is that the synovial fluid supplies lubricants to the joints to ensure that the joints are constantly lubricated. The essence of the lubrication is to ensure that there is no form of friction or collision. And that's something you have in all your vehicles, your machines. It's a basic principle of physics. When two things touch each other, there is friction. And once there's friction, you're going to have wear and tear. It's as simple as that. And so the arthritis, or more specifically osteoarthritis, why I'm emphasizing this is for you to, when we talk about treatment, you know what we are trying to do, what is we're trying to solve, is that you now have those cartilages, those tissues. It's either the body is not, it could be genetic, all right, autoimmune, where you have rheumatoid, the genes or proteins that are coding for the synthesis or production of the synovial fluid. Either they have mutated or they are not even there. The proteins are not there. So you cannot have the fluid. Or it is not sufficiently supplied. And it could also be connected to your age, just like Prof has said. And so when you have those tissues wearing out, not properly lubricated, you'll be having the joints, the bones colliding. And whenever the bones collide, the signal is sent to the person is pain. It's inflammatory. It is a serious pain. You understand what I'm talking about? So that is basically what we are looking at here. So in the what's it called? In the testing, you want to look at the degree of the damage around that region. What is the degree of wearing? What is the degree of collision? How much synovial fluid is still being produced? Are the joints properly lubricated? These are certain things you want to look at. And then if you're going to, you also see what is the degree of the damage of the cartilages. All right. That will inform the decision, of the healthcare provider to know the type of treatment regimen to adopt. Is it to give you something that would help in the production of the synovial fluid, or to give you certain medications that will help to more or less increase the production of calcium or absorption of calcium? Because when you look at the bone chemistry, there's what we call bone resorption and the bone absorption. The bone absorption is simply the absorption of calcium. And calcium is a major component of what? Of the bones. So if the rate of resorption and absorption, they keep occurring throughout our lifespan, throughout our life journey. But when someone is born, when you are born as a child growing up, the degree of absorption is usually higher than resorption. Absorption is simply the absorption, the collection of calcium into the bones to increase the bone mass. So as a child is growing, the rate of absorption is usually higher than resorption. Resorption is the release of calcium out of the bone mass. It's a cycle. As the calcium is used, it is released. Calcium is used, it is released. It is used, is released. So, but as you grow older, sometimes the rate of resorption may become higher, where your body is now releasing much more calcium than it even absorbs. You understand? So these are things that will form the decision whether to just, give the, we'll call it a mineralization, where the patient will just be given the calcium mineral. All right. So if the problem is low calcium content, can give the patient just calcium and vitamin D. All right, to activate absorption of the calcium, and so and over a long time you can have that bone or that arthritis being managed to a greater degree. Okay, so these are just the basics. So the treatment. How do you not treat arthritis? Well, if you look at what we have explained so far, you realize that it is almost incurable, right? But the best we can do is to manage the situation. That is why orthopedic doctors are always, the medical world, there is virtually no cure for most of these health conditions, apart from infections and all that. But a lot of these other problems that affect certain organs in the body, they usually have no cure. I mean, you can't find a cure for them. All right. So what we now do, like hypertension, when you have atherosclerosis or thrombosis, when you have the kind of cardiovascular problems, the best we can do is to manage the situation. You can't cure them. All right. I think I have said this a couple of times. So how do you now treat osteoarthritis? Basically, if you're going to treat it or going to manage it, the patient is experiencing pain. So the first thing the healthcare provider would like to do is to manage the pain. So basically what we do in the treatment or management of osteoarthritis is to knock off the symptoms. That's simple as that. Try to reduce the pain to the barest minimum. You understand? So you want to see medications like NSAIDs, non-steroidal anti-inflammatory drugs. All right, NSAIDs like diclofenac, aceclofenac, diclofenac sodium, diclofenac potassium, aceclofenac, acetaminophen like ibuprofen, and all those NSAIDs. What basically they would do is to get to the cos 1 and the cos 2. That I don't think I should go into details in that, but there's what called the cos 1 and the cos 2 ratio. All right, and so what the NSAID will basically do is to get rid of the inflammation. That inflammation is what brings the pain, right? And so what the NSAID will do is to manage the inflammation. Note this: the NSAID is not going to treat that arthritis. It is never going to do that. The damage in your joint, the damage in your cartilages, the NSAID would not treat them. They won't solve them. What they would do, they are called anti-inflammatory drugs, non-steroidal. They're not steroid. We also have steroid like the corticosteroids. So, but what the NSAIDs will do, their business is with the inflammation. That sensitization that is sent, call it type 1 hypersensitive reactions. And so once it is sent, your body feels it as an inflammation. And so what you want to do now is to manage that inflammation. So when the doctor gives you NSAIDs, like basically we call them painkillers in local palace, painkillers. So it's just to kill that pain. But like I said, it is not going to solve the arthritis. But at that point, the doctor would like to reduce the pain because the patient is going through, a couple of pain. All right. So that's that on that. You also have these days now, a lot of these OTCs, NSAIDs are now OTCs. But before now, they used to be prescriptional. You don't just go to the pharmacy over the counter and you just ask for diclofenac. It's not paracetamol. All right. And there are various kinds of, painkillers that can be given. In some degrees, in some times where you have a very severe case, a chronic arthritis, not acute, chronic arthritis that has been for a long period of time. The person is having very serious pain. The pain has lasted for more than 6 months. The person is aged. So for those chronic cases of arthritis, they want to give them some kind of medications that are not NSAIDs, because NSAIDs, the non-steroidal anti-inflammatory drugs, they could induce ulcers. So patients who are ulcer patients, they don't want to give them NSAIDs because the NSAIDs they pass through the gastric mucosa. And once they pass through the gastric mucosa, because they are acidic, the NSAIDs are acidic. So they will have a way to corrode. They'll corrode with the mucosal linings of the gastric layers. And once the mucosal linings of the gastric layers are corroded, you're going to have ulcer. So if the patient is already an ulcer patient, you don't want to give the person an NSAID, because if you take for those of us that will have pain, you just go to the pharmacy and say, I want buy give me painkiller. Always ask them, what kind of painkiller are you giving me? If they give you an NSAID, all right, a good pharmacist will ask you, do you have ulcer? Do you treat ulcer? Are you an ulcer patient? Have you ever had ulcer? So if you tell the pharmacist yes that you are an active ulcer patient, it's not going to give you an NSAID because it's going to kill you. If it gives you an NSAID, you bleed almost throughout the night because it will go to your mucosal lining and give you serious kind of pain. So you are trying to take care of pain and you're giving yourself another kind of pain. All right. So more often than not, for those severe cases where the patient is also an ulcer patient, they will now give, or the patient could be predisposed to ulcer. All right. So there are other kind of NSAIDs we now do and some coverings, like you have the medications that come with cholestyramines and misoprostol. All right. And then for some degrees, very high degree of pain, because we have different degrees of pain. You have the mild pain, you have the moderate pain, and you have the severe pain. So for those severe cases, there are some people you will see, they can't even walk. By the time they walk from here to just 2 meters, the person will sit down somewhere because he's going through a very serious kind of pain. So if that patient is having a severe pain and is also an ulcer subject, they will likely place the patient on certain medications like opioids. Opioids, examples of them are the tramadols. All right, tramadol is a very good example of an opioid. Unfortunately, it could be addictive and abused. And so it is placed under very serious control. All right, because young people take them for other other needs or uses. All right, and so for severe cases, you want to give them opioid because the opioids are very strong painkillers, and at the same time, they do not cause or induce ulcers. So they are safer for patients that have ulcers. Okay, you have the corticosteroids, right? And so that's it. And then there are times where you may also have to do most of the time when you are engaging a patient that has arthritis, especially chronic cases, you also want to, most of the time you see the doctors who always want to do that side by side with physiotherapy. All right, the physiotherapists are also very important, because whilst you're taking the medications, you also need to go through certain physical therapies where they can help you do some adjustments or massaging and all that. And then they use even some NSAID gels, like diclofenac gels, like Ofen gel and the rest of them. They rub these gels around that region where you're having that problem or the pain. And then whilst you're taking your medication to see your doctor, your consultant, they also refer you to the physiotherapist. Physiotherapists will also help, because the physical treatment also matters, because a lot of these patients sometimes are docile. They don't want to walk, because when they try to walk, right? So they want to ensure that somebody is also helping you to do some physical and then there are some cases where it has gone beyond use of medications, where the patient is now placed for surgery. There may be situations where you have complete or partial bone replacement. All right. Well, it's quite expensive. It's not cheap. It's quite expensive. You can have that bone replaced, and certain prosthetics can be placed there. All right. And we expect that after which the pain should go down. But at the end of the day, it will not give you an overall treatment, an overall solution to it. All right. So my prayer for us is that we do not come down with this problem. And so just before Dr. Chus comes in, if you have listened to all I've said so far, I said something about the tissues, the cartilages being damaged. And so the holistic solution would be to find a way to repair the damaged tissues. To find a way to repair the damaged tissues, and not to give painkillers, because the painkillers will not solve the arthritis. They will only take care of the inflammation. They will not solve the root cause of that problem. So whatever option that will help, not just to manage the pain, but to also deal with the root cause, which is the damage, the wearing out of the joint tissues, would give a much more long-lasting solution. Thank you at this point, and God bless you. I leave the floor open for Dr. Chus to come in.
Thank you, Fam. We're very grateful. Let's invite our Fam did a wonderful job. Let's appreciate him. Go to the chat column and appreciate our Fam. At this point, let's invite Dr. Chus, our wonderful doctor. Doctor, are you around? Hello, doctor.
And pharmacist, please, I don't know, there's a noise around the background. Super live. Super live.
Life is super.
I just need to be sure that you are hearing me. So the topic we have today is arthritis. And you see the first speaker, Dr. Rose, have made mention of the different types of arthritis, and the pharmacists have given you a clear analysis of how it can be managed. So my own is to tell you the role of Superlife products and the new Superlife Superlife Terra technology in the management of disease conditions, especially arthritis. So normally our Superlife products that we use for arthritis is the STC30 and the SROC, that is the Super Root Coffee. And sometimes we also add SIC, Superlife Immune Care, because we know arthritis is one of also the autoimmune diseases. Along other causes or other classification of it, it also distorts the immune system. And when the immune system is distorted, to get rid of it is difficult. So that's why this pharmacist was telling you it cannot be cured, just to manage the symptoms, and the person can lead a normal life. But our product sometimes does the reverse and brings a perfect solution to that condition. Because the Superlife product that we use, the ST30, is a stem cell product. So arthritis haven't destroyed your cartilages, haven't destroyed your synovial fluid. The stem cell will regrow what we call the synovium. The synovium is where the synovial fluid is produced. And it is that fluid that lubricates the joints and also lubricates the cartilages. So when the synovium is replaced, another one is regrown, or if the synovium was not destroyed initially, but the synovial fluid is infected, is ineffective. Instead of lubrication, it is now frictional in nature or in texture. Then the Superlife, we have to, the ST30 by stem cell therapy, we have to regrow a new synovial fluid, or we have to change the nomenclature of the existing synovial fluid that is already assuming the friction nomenclature. So you see that's how our stem cell therapy. So just like as the pharmacist said, that why it cannot be cured, because the synovial fluid or the synovium cannot be replaced by the drug or the drug therapy. So, but the stem cell therapy by ST30 replaces that synovium, rejigs the synovial fluid for efficient function. And not only that, a cartilage that has been destroyed, which now generates friction between the bones at that joint, and establishing the pathophysiology of that arthritis, our stem cell therapy replaces the cartilage, builds another cartilage. That is what it does. It enhances what we call chondrogenesis. Chondrogenesis, the pathway of production of cartilage. It builds more chondrocytes, and it enhances more of the precursors of cartilage. That is the chondroblast. So that is what the stem cell therapy does. So you see, when it does that, then eventually it eradicates the arthritis. So that is the uniqueness of ST30. Then I was very happy when the pharmacist was talking about bone resorption and bone adsorption. The XROC, Super Root Coffee, does a lot of that. So it facilitates the balance between bone resorption and bone adsorption. That Super Root Coffee. by reason of the glucosinolates and the quasinoids inside, because the marker is filled with glucosinolates, which have many secondary derivatives, and that helps in bone absorption and bone resorption balance. Then the quasinoids, which originate from the Tungsat alley, which is
requiring FEC approval. The period of advertisement should not be more than 6 weeks. All pre-award procurement processes will be completed by the end of 2025. All FDA was on implementation
components of the so that is it. Then as I was saying, I was happy when he was talking about the bone resorption and bone absorption, which sprouted coffee does. So you see, the combination of that gets rid of arthritis. Now, basically, the pathophysiology of arthritis is inflammation. And inflammation is one of the bases of establishing one of the bases of a pathophysiologic method of establishing diseases. So, and when there is inflammation, the disease is already established. So the inflammation helps in producing symptoms. Now, Superlife product ST30 and SIROC helps to, they have anti-inflammatory properties. Of course, the antioxidants that are resident in the anti-inflammatory. So they help to eradicate that inflammation. So once that inflammation is removed, then the symptoms abate and you no longer have the symptoms. So that was what the pharmacist was trying to say. So the use of drug removes the sensation of pain because it sends signal to the brain that as a pain killer, it takes away the sensation of pain. So you no longer feel pain, but the inflammation is still there. So the ST30 or super root coffee, by reason of the anti-inflammatory components, it removes the inflammation completely. So it does not only send signal to the brain that the pain is off. It's also send signal to the immune network system that the perfect communication around that joint. There's no more disjointed communication that leads to that. That is the use of ST30 and SROC, of course, autoimmune disease like rheumatoid arthritis.
The network is very, very low. Doc, we can't hear you again.
Recording in progress.
Sorry, his network is. Hello, Doc.
Was saying,
Sorry, it's fluctuating.
can you not hear me?
It's better now.
Hello? Hello?
Hello,
Hello?
Doc. Yeah,
But I can hear you. I can hear you.
your network is
Can't you
fluctuating.
hear
Yeah.
me? Yes, I was talking about the. Yes, can you hear me?
Yes, yes.
But I can hear you. But I don't know why you people say you cannot hear me. I can hear you
I
now.
can hear. We can hear you now.
Hello?
Hello, Doc. We can hear you
I
now.
was talking about yeah, autoimmune, the autoimmune rheumatoid arthritis. So the rheumatoid arthritis, as a result of the autoimmune, I was saying, is when the immune cells not seeing other cells, tissues action of the immune response system, because they are not supposed to see themselves or other tissues as enemies. They are always supposed to see it. So when that autoimmunity, is established, already there's already dysmodulation of the immune response system. Now, SIC is power packed, is full of immune cells. We have macrophages, we have the white cells that help in the immune defense system. So what SIC does, it goes to the immune system and does what we call immune modulation. Immune modulation. When it does immune modulation is to, correct that discommunication in the immune systems where they are not seeing themselves as an enemy. So immune modulation is adjustment of the immune system. Immune modulation is, control of this the cell defense system or the body defense system. So where the macrophages or the lymphocytes or the mast cells, the release of them should not be to attack themselves, but the release of them is to attack invaders. So when the immune system is modulated for a perfect immune response system, it directly or indirectly helps to eradicate the effect of autoimmunity. So when that one is abated, then the rheumatoid arthritis begin to take begin to abate and for a perfect So that is how our product SIC, even all the other two products, Super Life Total Care S30 and Super Coffee, they also have immune boosters that also help in immune modulation to get rid of autoimmune disease conditions. Now, the other few time that is remaining, let me just talk about the S-Terra Tech, that is Super Life Terra Tech machine. The Super Life Terra
Nobody's
Tech.
talking again.
Nobody's talking. Are you not hearing me? I'm talking now.
We are waiting for him now.
I'm talking. Are you not hearing me?
We are being hopeful network.
Hello, Super Life.
Life is super.
We can hear you. Go ahead, sir.
So the Super Terra Tech machine is a new device that was introduced by Super Life of recent. is a terahertz technology machine. Terahertz is a frequency.
Your network is not, it's fluctuating.
The transmission company of Nigeria, TCM, lists them experiencing power outage currently. They include Maitama, Wuse, Jabi, Lifecam, Asokoro, Chaku, Makushi, and parts of the presidential villa. TCM says its engineers have already been mobilized in spite of the incident to repair.
Please, everybody should mute their phone. Don't mute, please. Just mute your microphone, please.
In the
Hello, can somebody hear me?
Dr. Rove, yeah,
Yeah.
I can hear you.
Yeah, please.
I can hear
Samson, let Coach Samson just take it up from there on the Estera Tech. Since Dr. Chu's network is having issues.
the network is very, very poor. It's fluctuating. We can't hear him.
Coach Samson, please, can you take it up from here?
Hello, Coach Samson, are you there?
Yes. Okay. Let me quickly. I think
Doc's still talking, but it's not audible. Hello, Doc. The network from your end is very, very poor. It's fluctuating. It's distorting your voice. We can't hear you.
hear me. Yes, where I am, but I can hear you.
From this end, we can't hear you. The network is seriously fluctuating. For over 5 minutes now. We couldn't hear what you just said.
Can you hear now?
I can hear now. I can hear now.
So what I was saying, I was talking about this Estera Tech machine.
Better.
I was describing the technology behind the use of that machine or the construction of that machine. That terahertz is one of the technology. Terahertz, that tera they wrote today, is an abbreviation for terahertz. Can we hear that? Tera is an abbreviation. So tera is an abbreviation for terahertz. And I said terahertz is a frequency that is in between microwave frequency and infrared ray frequency in the electromagnetic spectrum. In the electromagnetic spectrum, we have a variable different electromagnetic rays that emit radiation. So we have the radio waves, we have the infrared, we have the microwave, We have the visible rays, we have the ultraviolet rays, we have the X rays, and we have the gamma rays. So, but terahertz is in between microwave and infrared. So, and that is what they utilize. Why did they use that? Is because it has low energy frequency and it has long wavelength. It has low energy frequency. So, low energy frequency, one that goes into your body, does not damage because it is not ionizing. It does not knock off electrons from your biomolecules and start destroying the cells or tissues that it missed. So that is why it is non-ionizing. So that is a very good advantage of that technology. Then it has long wavelength, so it can penetrate deep as long as the exposure time penetrates deep into the tissues, into the cells, into even the bone marrow. So that is one of the advantage of that technology, the terahertz technology. Now it was made also the another energy that was or principle that was used in that machine was a quantum principle. You know, where photons of light or ray of light comes in packets of energy. We call that packets of energy quantum. So the ray, the radiation that machine Estera Tech releases is a form of quantum. It's a form of packets of energy. So it has a mass. It has, a magnitude that it goes straight with that quantum nature into the body, and elicits therapy for the body. So that was another technology they used, quantum technology. Then the last technology they used is in making this device, in the operation of this device, is optical quartz technology. What is optical quartz? If you look at this device the way it is on the screen here, you see that the glassy area of it and the entire makeup of the system is made up of crystalline quartz, which is called optical crystalline quartz that they use to make that machine. The advantage of using that one is that it withstands high temperature. So that when you use that machine for a long period of time, it does not damage, it does not reduce its efficiency, because some machines, after some time, when the temperature gets hot, they start malfunctioning and they start giving you negative results. But this TerraTech device withstands high temperature, so as long as you use it for that day, the temperature does not affect the machine. So it withstands high temperature. Then the machine has a way of switching itself off, like a bimetallic strip of electric iron. So when you use the machine, using the machine, after the time you see it will trip up by itself. Then you on it again. So it's one of the method of making the machine durable and to reset itself and function properly. Then the optical quartz, another property is it has low thermal expansion. When you use, there are some machines, when the temperature gets high, the metals or the components of that device gets expanded, and when they expand, the contact is broken, then the machine ceases to function. So, but this Estera Tech, because the optical quartz has low thermal expansion, so it does not expand as long as you use it, even no matter how lengthy the time you use it. So then it is also, accidentally for solution that is not supposed to fall into, it will not be destroyed because the quartz resists chemical damage. There's also birefringent. Birefringent in the sense that it can polarize a ray that is coming out from it straight to the side that you want it to go. So it can polarize light, can split light into different directions. So when the beam, it is a blower. This machine that you are having is a blower. I want you to know that it's not what do you call it? It's not a diagnostic device. That Estera Tech machine is not a diagnostic device. This one we have is a blower that emits radiation, and that's terahertz radiation, and it produces a therapeutic value for the body. So it's a diagnostic machine like X-ray. it's not a diagnostic machine like MRI machine. So it's not a diagnostic machine like gamma counter. So what is it is a physiotherapeutic machine. So it is and also a therapeutic machine on its own. That's what it is. Now, so you don't think that when you carry that machine and you point it to the chest, the person it will read a heart problem. No, don't ever think about that. It is just a therapeutic machine to help you get electromagnetic radiation, which is of terahertz, low frequency radiation and long wave radiation that will help your management of disease conditions. So as I said before, the optical quartz technology also is by refrigerants, as I said, it's able to polarize right now. One of the advantage of this machine, why the body is able to, why this machine has high medical benefits is because of a property called dielectric property of the body. Dielectric property of the body. The body has the ability to absorb radiation, absorb radiation and those radiation into the cells and into the tissues. Are you getting it? So the body can absorb useful radiation. Just as you go for X-ray, the body absorbs it. So that is a property called dielectric property of the body. So that was one of the greatest advantage of the body that of the principle with which this terahertz operates. So the electric property of the body and the conductivity property of the body, of the blood, or of the body fluids. So when the terahertz is focused or beam on any part of the body, the radiation goes there. It does not ionize. It goes through the tissues, into as far as the hypodermis. The skin. You have the epidermis at the subcutaneous level. Then you have the dermis at the inner level. Then the innermost part is the hypodermis. The radiation goes as far as that place. So, and as it goes in, what it does, for example, it helps to get rid of inflammation. When cells are inflamed, it gets rid of inflammation, goes there, sensitizes the cells, knock off the inflammation. So you can say, like cases of arthritis, this machine is very important. It can knock off inflammation as fast as possible. Then so when it knocks it out, and when it rejigs the cell, it's trying to sensitize the immune system again. So if there's immune challenge, it will help to modulate the immune response so that it will knock off the immune challenge. So that is another benefit that machine. So as we said, it's a machine for to our life business. Sometimes we are to be combining with existing life products. When you life product, you use the machine, it will bring a lot of benefits. Then now this machine also will help us to produce what we call energized water. When you put water in a cup container for about 30 minutes or so, the water molecules that are held together by hydrogen bond, it will dislodge that hydrogen bond and release the molecules to be free to increase their vibrational energy, increase their transitional energy. So you now have like thermal water, and the bit of that thermal water or hydration is for better hydration, is for better cell form. So when there's warm water therapy, so but this warm water therapy that you get to a heat system, you heat up water, you allow it to cool and drink. But this one is not like that. This one, you get it through electromagnetic induction. You use electromagnetic radiation to, dislodge the bonds, only water molecules together, increase their thermal capacity, increase their thermal nomenclature, and it will help for better hydration. So when you energize water like that, give to the person, the client who want to use that machine for, after giving that water, then you use the machine on that client. There's also have other water that you have also energized on ground. After you have used the machine on the person, also will give another glass of water to the person again after using it on the person. So it's for better hydration. Now, the usefulness of this machine, before I round up, in cases of cancer is, this radiation is highly absorbed by water. Terahertz radiation is highly absorbed by water. And it is true that cancer cells have more water content than normal healthy cells. So if it goes and there's any cancer cell that enters the body, and because we know that cancer cells have more water content than every other cells, it absorbs that radiation. And when it absorbs that radiation, it sensitizes N killer cells. It induces programmed cell death and apoptosis, and then helps to get rid of that cancer cells, and from there help in cancer management. So also, we have water content in intracellular cell. The intracellular component of cells, we have more water than the extracellular. So since it is absorbed by water, when the intracellular component absorbs the water, both the extracellular component absorbs the radiation because they have water, then it enhances the hydration of those cells and enhances their better function. So when all the functions or the cells are functioning well, the tissues are functioning well, then that's a perfect immune system, and the person will be at good health. So apart from disease management, it's also for disease prevention. It's also for a good healthy living. So I will stop here because of time. I think we will have more time to deal with this Estera-Tech, full lecture on Estera-Tech whenever I may come up again by God's grace. So we will stop there because there's too much time. Thank you very much.
Thank you, Doc. Thank you, Dr. Chus. Thank you, Dr. Chinaka. And thank you, Dr. Ebe. I think there's a whole lot. This is a very wonderful, loaded information. Just like I said earlier, arthritis is a common disease, but today we could see different dimensions that I, as a person, I've never. This is my first time, and I believe as many of us that are tonight's workshop, you might be seeing it as a very new expository meeting. So thank you. I don't know. I think we are already, time is not on our side, but even at that, we would like to encourage, if you have any question, please quickly go to the chat room to drop it. Drop your question so that the doctors in the house will attend to it. So then we normally want to, at least for as many that want to adopt our product, which is not negotiable at all in today's world. The experts in the house have already made it clear. Other ones, they use it like a palliative. When you are approaching orthodox or whatever, is palliative. It's just to manage. But by the special grace of God, this plant-based stem cell therapy is from God. It's natural. It's a God sent to you and I that are in this present generation, so that we can go back to the Eden, the nature, and the way they have used both technology to package it. That's why our mother company, we said, is discovered by nature, realized by science. That's plant-based. That was what caught my attention. 2018. It said plant-based stem cell is discovered by nature, realized by science. So it means that even if you're undergoing any medical condition now, orthodox or whatever, ensure that this one is in place. Ensure that you use plant-based stem cell therapy alongside with whatever medication or treatment you are going into, so that it will give you a holistic health. So now, please, if you yourself as a person, and is a product that you can use on a preventive measure. So if you are now, personally, using it even as a preventive measure is even the best way. It's cheaper to prevent than to cure. We have been using that slogan: prevention is better than cure. Prevention is cheaper than cure. So it's a product that if you start using it today, it will go down to your cellular level and start restoring your system. I don't know. So, and now, how do you assess this product? It's better assess the product by connecting to the company, the only company in the entire world that God gave the secrets through Mibai Chemistry. They are the company now that have come out in all the continents in the world and begin to showcase these products in a genuine way. So, and that is Super Life. So that's the company that we're talking about even tonight. And that's why I so much love all the medical experts in the room who are passionate and compassionate over our brothers and sisters, over humanity, who have been suffering from one ailment to the other, multifunctional, dimensional ailments. So please, you can just be our customer or customer to the company so that somebody is not buying the product and reselling to you. And many a times, those that are in that side are those who are dealing with not original products. So we want to encourage us, please connect to the company. You have a lot of advantages to connect to the company. You are guaranteed that what you are getting is genuine. Secondly, you are guaranteed that subsequent purchase, you will be getting it at the company's discounted price. Company will know you, you will know the company. You have their send a correspondence to them, even though they are in Malaysia. They will respond to you. Then again, the cooperative nature of it will help you to complete your therapy. Is not is a therapy of depending on the case at hand. It might take 90 days. It might take more than 90 days, depending on the condition at hand. But the one thing is sure, that you are getting back your health naturally. Is restoring your health naturally. So I don't think there's anything better than that. So please, for you to be part of the organization, is just have your valid ID card. Any of our government licensed ID card, whether NIN or voter's card or driver's license or international passport, any of these four is you're eligible to be part of, to connect to the company with your valid ID card. Every other thing is secondary. So please don't don't be a victim of whatever fake that is flying in the country in the name of selling cheaper. So even if it is a fake product that you are getting at a free cost, how can you take something free that will complicate your health? God forbid. So please, time might not permit us to either begin to just use this customership. Please come and connect to us. We will support you, even to ensure that, because your testimony is so important to us. The earlier you share that testimony, meaning that the earlier you will start recovering back your health, the better for everybody. Even the company will be super excited to hear your testimony. And we are there. We are very much more available to us to support you, to assist you until you get your health back. So I said earlier, I don't know whether there are some questions in the chat room. So because we have just a few minutes, we should be closing by 10 o'clock. Any questions?
Sorry, please, a short one. Please, what is the registration price for 2-pack STC party now?
That's the registration for 2 packs. That's a star package. That's 90,200. That's 90,200. 90,200. for star package.
Okay. Okay,
Then,
thank you.
yeah. So other packages are there. As a customer, we don't worry yourself about because time did not permit us. But just be rest assured that we can forward you the price list. Price list and the package, that's the package price list in Naira. And one thing I can let us know is that among where all the continents of the world where our products our companies have spread to, Nigeria price package still remain the cheapest. Please, you can reach out to me for me to show you why is the cheapest. I was discussing with somebody in Ghana today, the same thing. He discovered that the amount they gave it to her in Ghana, if you convert it to Nigerian Naira, is far more expensive. But with the leadership of the company in Nigeria, we did one thing. We reduced our cash outs. That is a voluntary decision in order to contribute to the society. We know that if you are in Nigeria accessing these products, of course, we just felt we have to be grateful to God Almighty, knowing fully well that getting the original product of this company will go a long way to restore your health, irrespective of how long that sickness must have been. So even as that, like this one I mentioned had to be 90,200. If not that we mortgaged or surrendered over 1,000 naira per dollar of our cash out, the money that we're supposed to earn as a bonus. If we have gone by the day of naira dollar rate, this one of 90,200 could have been times 2. The price, that could have, and that is what other countries are getting it. Times 2, which is 180 something thousand. That is what it could have been. But now it's 90,200 because the leadership and the members of who are handling this in the country, Nigeria, only Nigeria, decided to reduce their cash out and use it to support as many that want to use this product to handle their health. To God be all the glory. So every other 18th place, you can reach out. Our office that is here in Ikeja at Adeni Jones. Number 3, Tunde Gafa close. I don't know if if you are there, can you drop it inside the chat room? Our Lagos office address. Number 3, Tunde Gafa close by Aromire Junction.
Sorry, please,
Yes.
once again, your withdrawal rate to Naira is how much, sir?
Our cash out rate in Naira that's where angle I'm talking about. All the leadership here in the country reduced it to 550. Now we are now giving it out as 600. So if you minus 600 from 1,700 plus or minus, you will see that the leadership, the members have reduced it with 1,100 or 1,600, 1,000 naira less per dollar, as case may be. That's why that price is there. It's an international package price because the company has never changed price right from inception. Since 2017 till date, they have never changed their package price. These 2 packets has remained $110 anywhere. So if you go and check $110 by prevailing exchange rate today, you will see it could have been times 2 of this amount I told you. So, but that area I mentioned now, that is what made it to be lesser. But notwithstanding, like I said, a lot of fake products are in the street of Nigeria. That's why we have made a very good disclaimer so that you will know the source you are getting your product. The source matters a lot. If you get it in a wrong source, you will know these are people that after using the product, instead of getting better, the sickness will escalate. So we are very careful. So please don't be a victim. So Samson, are you there? Is there any question in the chat room? Hello, any question in the chat room? Okay, in the absence of Dr. Rove, please let me hand over the floor to you.
There's a question here. If Dr. Chooks is around, I want him to answer it. If he's not around, I'll take it. The question is, what is the difference between arthritis pain and sickle cell anemia kind of pain? Please, I don't know if Dr. Chooks is still around.
Yeah, I'm around.
Doctor, handle the question.
It's just the truth is that in arthritis, the pain is as a result of inflammation. So what brings the pain in arthritis is inflammation. In sickle cell, what causes the pain is inflammation, but it's not crisis that results is because during the transfer or the movement of the blood cells in the blood vessels,